Good morning, madam.
Good morning, Dr. Geetendra Sharma.
Yeah, madam, for the web viewers, I will like to introduce you. Madam is Dr. Rekha Rajendrakumar, and she is from Bangalore. She is medical director and IVF consultant at Miracle IVF Hospital and Chandana Hospital and Gynec Endoscopy Center in Bangalore. I can enumerate her degrees: MBBS, MD, DNB, FICOG, FICMH, PGD, MLE, MRCOG, and whatnot. She is fellow in reproductive medicine, gynecologist, and fertility specialist. She has diploma in human resource development. She is diploma in hospital administration. She is diploma in health and hospital management, and definitely she is medical director in IVF Institute. She is just now honorary secretary in Society Gynecological and Obstetric Society of Bangalore. She is also contesting for the post of EC in South Zone Kasoga. So she has received many awards. She was first. She had first rank in university in MD examination, and in MBBS she got 7th rank in a whole university. She has 6 awards in her belt and 3 felicitations at state and national level. She is committee members in many of the committees of FOXY, and she is even in charge of a few committee in South Zone. And she has given multiple publications, 14 original articles in her belt, and she has given more than 300 lectures in different conferences all over India on different subjects. So, madam, welcome. I welcome Dr. Rekha Rajendran, madam.
Thank you, Dr. Geetendra Sharma, for that exhaustive and wonderful introduction. So, shall we start our session now?
Yes, madam.
Yeah, I will not bother you with many questions. I have selected 3 questions for you. Okay, you have been helping us and been on our rescue many times when we had the medico-legal doubts. Some patients, some cases we get doubts. So those cases I have called you many times and taken your help regarding this ART issues.
Yes.
So here I have 3 questions now asking you. The first question would be regarding the oocyte donation. Like, I just want to, my question would be, there is a lady who is got good number of eggs, maybe a PCOS case or even a good person with lot of eggs. It's a very fertile woman. I'm sorry, fertile woman. There's lot of good quality eggs. Her AFC has been good. Her AMH is very good. Age group also quite nice in the very fertile group. At the same time, we have another woman who does not have eggs for poor ovarian reserve. AFC is low, AMH is low. Both we have concurrently stimulated, or even otherwise. The first person who is a good donor, the fertile woman, she's poor, unfortunately. Can she donate her eggs to the second person? Is it legally allowed for her to donate, and what are the terms, conditions, the legal issues involved in this? Can you please enumerate on this issue?
Yes. So the basic
for financial issues. I'm sorry to interrupt. Maybe for financial interest also, where her IVF cost will come down. That is her interest.
Yes. So basically, what I understand that one patient is poor, but she is having good amount of eggs, and one person is affluent financially, but she has no eggs, and she wants to procreate with the sperm of husband. Now, in such situation, see, there are different guidelines in ART. First guideline in 2005, that was ICMR guideline for ART clinics. And in that guideline, there was one section that was 3.9.3. So in that section, it was mentioned that if somebody is poor, that is a section regarding indigenous couple. So if some couple is indigenous or poor and not able to spend money for their own IVF treatment, then it was said that such kind of settlement to be done with some affluent couple who do not have oocyte. should be entertained. So that kind of section was there in 2005 guidelines. But so in short, in 2005 guideline, it was said that indigenous person, poor person, to reduce the cost of her own IVF cycle can donate a few hours to the person who is affluent but not able to generate her own eggs. But in 2010 guidelines, that was a 2010 ART regulation bill, it was there. And in the website of government, it is put as a guideline on the in 2010 also. So in that, again, there was a section 26 subsection 10. Now in that section, it was clearly mentioned that suppose somebody has given eggs for her own treatment, and if a few ovas are left, then either you have to freeze that ova for her own use, or you can perish it, or you can send it to for research purpose, but you cannot give it to anybody. So now
you can't sell it, you mean?
Yes, yes. So that section is now removed in 2010 guidelines.
Okay, okay, fine. That is good. Yeah, I understood that clearly.
Yes.
Yeah. Now I have a second question for you. Here the question would be regarding the sperm donation.
Yes,
this is not a regular sperm donation, what I'm talking about, the regular sperm banks or the donors. Here the question is bit unfortunate situation. In the sense, woman wants to get pregnant, but the husband is on deathbed, he's unconscious, he's on ventilator, had some head injury or something like that. And such a person, or maybe a posthumous donation also.
Yes.
So these conditions where the husband, the male partner, is not in a position to give consent for his sperms, how is the situation? How the woman should go about? Is she able to give consent? Is she the sole responsible person to give consent in this case? How can you elaborate on this issue?
Yes, madam, in 2005 and 2010 guidelines, in both the guidelines, there was in 2005 there was section 3.5.11, and which said that collection of gamete from a dying person, okay, will only be permitted with the widow's wishes.
Okay.
So if widow wishes to have a child with those sperms, then that will be allowed with the signature of the widow or woman in case of posthumous collection. And second thing, whenever person is on dying bed, on ventilator, not in position to give consent, so in that case also, with the consent of woman, if that sperms are to be used by that woman only, that widow or to be widow, then with the consent of her only, the sperm collection can be done. And the same thing is mentioned in 2010 guideline under section 23 subsection 6. The same thing is reiterated that it can be done. Although it can create many legal problems in future, because in act itself it is said that no ART technique should be done without signature of spouse. But here they have allowed in both their guidelines, and that is the issue of debate. We can debate on this issue.
They are married and he is not able to give consent, so ultimately she's the only person who is left.
Yes,
so
yes.
That way it is legally allowed, I understand.
Yes, yes.
Okay, that was fine. Now coming to my third and the last question, this is regarding embryo donation. See, yes. I have a couple where the woman is PCOS and she has given me lots of eggs, and thereby I have made lots of embryos and I have frozen in my cryocans. There is another couple where the embryo donation is the indication, where both male and female both have problems. I don't want to elaborate on the reason, but ultimately they need embryo donation. Say, example, elderly couple were not able to get their own embryos. Yes. So how is the status in India regarding this? In the sense, can these embryos, can it be used for the recipient couple? Can the commissioning couple donate?
Okay. So basically, to understand the term embryo donation, we must understand two things. Whenever we do embryo donation, ideally what should be done? Ideally, you have to select anonymous donor sperm, anonymous donor of ova, and then you have to make embryo. and that embryo
Okay.
is transferred in commissioning woman. Okay, so if you do that, that is considered as embryo donation. Now, what
Good.
you are telling, that some surplus embryo of some couple which is
Yeah.
lying in your bank, they have
Yes.
frozen, and if they are excess after their treatment, suppose somebody has become pregnant and some embryos
Yes.
are lying in your ART
And
bank,
they don't want those
and
embryos.
yeah, and
It's
they
been
want to
happening in many of the
donate
ART
it,
centers here.
donate it to somebody. So
Yes.
in 2005 guideline, madam, there was
Yes.
a form that was in section 4.4 that was for freezing for embryo, and in that form it was written that if couple does or husband dies, then what should be done to the embryo, and if wife dies, then what should be done to the embryos. That kind of consent we are supposed to take, declaration to be taken, and there were four options given. First, that they can allow it to perish. Second, they can send it for research purpose. Third, in case of death of husband, the husband may say that give it to my wife. And fourth option was there that you can donate my embryos. Okay, so there were four options in that 4.4 number form in 2005 guideline. But the same forms were revised in 2010 ART rules. And in that particular, there was form G that was for freezing of embryo. And in that particular form, there were previously four options, but fourth option of donating the embryo is removed now. So now there are only
Okay.
three options. Now it is said that either you can allow it to perish or give it to my wife or give it for research purpose. Now the fourth option which was there, that you can donate my embryo, that is removed from 2010 guideline. So
Okay.
the excess embryo which you have frozen in one of your clinic or RT clinic or in embryo bank, that you cannot donate to anybody else.
So you mean to say it has to be from a random couple, in the sense
Yes,
random partners, separate
yes,
contributions, and then make your own embryos in the lab, and the
yes.
only those are allowed to
So,
you.
the reason behind this is that if you use embryo of somebody, some couple, which is lying in your hospital, ART clinic, then you are going to replicate the same genetic material. Okay,
Great.
and that is,
Agreed.
you will be creating brothers and sisters in the society. So that is
I
not
know.
justified. So that's why,
Multiplication of the genetic material.
yes, yes.
I
So
agree.
hope,
Yeah, I agree. Yeah, thank you. You have answered and cleared all my doubts regarding these three questions. I hope to communicate and continue such question answer sessions with you in future also, for my own benefit, in the sense I can get a lot of questions and doubts cleared. You are really so clear, not only about the ART rules, even about the latest ART rules. The modifications, the point number 4 is removed, only 3 options are allowed. So many points you are making it so clear. You are abreast with the new ART rules. Thank you so much for clearing many of my doubts. And I also wish for your success as a Vice President, North Zone. I'm sorry.
best zone, madam, best zone.
Yeah, really wish you that you come out with the bright colors and be very successful in your future.
Thank you.
Yeah.
Thank you,
Thank
madam.
you so much. Thank